You know that smell in the American Southwest right after a wet spring? It smells like rain and blooming wildflowers pushing through the red soil. It's this beautiful, deceptive calm. Everything looks like it's recovering. Well, let's jump right into this explainer because behind that blooming landscape, something else is recovering, something totally invisible. Right now, inside the rocky arroyos, the dusty crawl spaces of old adobe homes, and the sealed walls of winter sheds, a surge is happening in absolute silence. The deer mouse is thriving. See, the rains brought grasses and seeds. More food means more mice, and more mice, that means more of what those mice carry inside them. We are talking about a virus that literally lives in the breath of a rodent. Now, hantavirus isn't your typical bug spreading through a crowded airport or a shopping mall. It actually lives in the animal's saliva, urine, and droppings. And here is where the mechanism gets wild. When those materials dry out and break apart, the infectious particles become airborne. This is called aerosolization. Microscopic particles suspended right there in the air, and you can't smell or see them at all. You don't even have to touch a mouse to get sick. You literally just have to breathe in the wrong room at the wrong time. A person inhales, and just like that, the virus enters the respiratory system. Once it's in, the virus zeroes in on the lungs, triggering what's called hantavirus pulmonary syndrome, or HPS. It's brutal. The lungs begin to fill with fluid, the tissue swells up, and oxygen transfer just collapses. The CDC classifies HPS as a rapidly progressing and frequently fatal respiratory illness. And rapidly is the absolute key word here. The time from your very first symptoms to total respiratory failure, that can be fewer than 5 days. But the terrifying part is it's almost always misread at first. The early symptoms are fatigue, muscle aches, a fever. It looks exactly like the flu. The virus is quiet at first, raising zero dramatic alarms, until the window to actually do something about it is closing incredibly fast. And that brings us to a really stark reality. The mortality rate. 1 in 3. Yeah, roughly 1 in 3 people who develop HPS does not survive. And that ratio has barely shifted in 30 years. There is still no approved antiviral treatment for hantavirus in humans, no licensed vaccine. The only medical response we have is supportive care. We're talking oxygen therapy, fluid management, mechanical ventilation. And for any of that to work, it has to start incredibly early, well before the lung flooding becomes irreversible. Before we dive any deeper, I want you to pause and think about your own life for a second. Have you ever personally been in a space where hantavirus risk crossed your mind? Maybe sweeping out a dusty cabin, exploring an old barn, or staying in a backcountry trail shelter. Drop your answer in the comments right now. I genuinely want to know, because understanding our own proximity to these environments is step 1 in understanding the actual risk. So to understand what it takes for hantavirus to leap from a background risk to a full-blown outbreak, we have to look at history, because history here is a measurable pattern. Back in May 1993, in the Four Corners region of the U.S., a cluster of young, totally healthy Navajo people began dying. Physicians were completely baffled. Within weeks, the CDC isolated a previously unknown strain. They called it the sin nombre virus. 24 people lost their lives. Fast forward to August 2012 in Yosemite National Park. 9 cases, 3 deaths. And that pattern points an arrow straight to our current risk window. From 2024 to the present, the cycle just keeps running. Let's jump back to 1993 for just a second. What made that outbreak so incredibly alarming wasn't just the death toll, it was who died. Hantavirus disproportionately killed young, healthy adults. We're talking athletes in peak physical condition. And the reason why is something called a cytokine storm. It's a severe, almost violent immune response where the body's own defense system overreacts and actually floods the lung tissue. So the most crucial counterintuitive takeaway here is this. The virus tends to be most violent in people with the strongest immune systems. Your strong immunity literally becomes part of the mechanism that hurts you. Okay, so how does this actually build up in the wild? The 1993 investigation uncovered an ecological engine, which has since been documented by the World Health Organization and PAHO. It happens in 4 highly measurable steps. Step 1, a precipitation surplus, unusually heavy rain. Step 2, a vegetation surplus. Suddenly there are abundant seeds and grasses everywhere. Step 3, a massive rodent population boom. In 1993, scientists estimated a 10-fold increase in rodent density. And finally, step 4, human-rodent contact spillover. Outbreaks aren't just random accidents. They are a measured sequence totally driven by the weather. The mice follow the rain, and the virus follows the mice. Which brings us right back to that Yosemite outbreak in 2012. Visitors sleeping in the Curry Village tent cabins fell ill, and tragically 3 died. This event was a massive wake-up call because it proved that millions of everyday tourists from around the world are also highly vulnerable. It wasn't just isolated rural farms anymore. The outbreak made national headlines and pushed the National Park Service to demolish over 90 structures and radically overhaul their rodent exclusion protocols. But remember, that underlying ecological engine we just talked about, it hadn't changed. It was just temporarily interrupted. And right now, that ecological engine is revving up again. Enter La Niña. This is a natural climate cycle that drives wetter than normal winters and springs in the American Southwest. According to NOAA and a 2022 peer-reviewed study in the journal GeoHealth, precipitation has been running well above historical averages over the last couple of years. This study explicitly modeled the statistical relationship between La Niña cycles, deer mouse density, and the probability of a spillover event. Their conclusion? They flagged 2025 and 2026 as elevated risk windows. And the data is painting a remarkably clear picture. If you compare the historical average rainfall to the current La Niña surplus, it lines up perfectly with a massive spike in rodent populations. The United States Geological Survey uses systematic life-trapping data, and their networks are showing measurable, real-world increases in deer mice across the Southwest through 2024 and into early 2025. At the exact same time, the CDC's disease surveillance infrastructure has flagged a notable uptick in suspected hantavirus exposures in New Mexico and Colorado for the spring of 2025. So, the ecological conditions for an outbreak, they're present, they're measured, and they're logged. Now, if we look south, the situation is even more acute. South America carries a massive hantavirus burden, with variants like the Andes, Laguna Negra, and Choclo strains. Pengho actually recently documented a 17% increase in cases down in Patagonia. On top of that, Chile's Ministry of Health, MinSal, had to issue an internal clinical alert because of elevated rodent activity right near human settlements. And here's the truly terrifying part. The Andes strain in Patagonia carries a documented, peer-reviewed exception to the rule. We're talking about actual cases of human-to-human transmission. That single fact drastically shapes how researchers are modeling global worst-case scenarios. But you have to realize, hantavirus isn't just a medical event, it's a systems event. Think about the clinical window, which is measured in mere hours, and contrast that with the vast geographic distance to an advanced medical center. Machines like ECMO, which stands for extracorporeal membrane oxygenation, can actually take over lung and heart function and vastly improve survival odds. But rural emergency departments, they just aren't equipped for sudden, severe pneumonia like this. The massive distance a rural patient has to travel to reach an urban, ECMO-capable hospital turns what looks like a simple logistical problem into a massive structural survival gap. The cascading consequences hit our human systems incredibly hard. First, you have agricultural labor disruption. Field crews and ranchers have unavoidable exposure. When workers fall ill, or even if fear just disrupts the labor force, that ripples directly into our food supply chains. Second, you look at the NIH surveillance, and it's chronically underfunded, receiving less than 0.1% of the NIID budget. Public health triage just pushes hantavirus to the side. And third, financial prediction markets are paying attention. Reinsurance firms are actually making actuarial risk adjustments for 2026 right now. They're recalibrating their multi-region biological risk estimates based on these very ecological indicators. So what does this all mean for you practically? Well, the CDC offers a highly specific, totally cost-free checklist to directly prevent aerosolization. If you're entering a sealed cabin or a dusty shed, Step 1, ventilate the space, open all the doors and windows for at least 30 minutes. Step 2, dampen all surfaces with a disinfectant solution. And Step 3, sweep safely, but only after everything is thoroughly wet. Doing this breaks the transmission mechanism right at the source, well before you ever start cleaning those enclosed spaces. You also absolutely need to know the symptom window, which runs roughly 1 to 5 weeks post-exposure. If you experience a fever above 101 degrees Fahrenheit, severe muscle aches, and this deep, heavy fatigue after being in a risky environment, you have to take action. And here is the crucial part. You must explicitly say the word hantavirus out loud to your doctor. Emergency physicians in non-endemic regions might not even consider it. Naming it yourself can accelerate life-saving triage by hours. And as we know with HPS, hours are literally the difference between life and death. Ultimately, hantavirus is a measurable collision between ecological change and human systems. The rodents are exactly where the data says they should be, and the virus is where the rodents are. So I want to leave you with this final provocative thought. If your region showed a documented hantavirus risk signal right now, today,